Welcome to the Human Momentum Podcast. I'm your host, Erik Schabert. I created this podcast to leverage 12 years of osteopathic medical training and over a decade of experience in primary care medicine to help sort through the confusing and sometimes contradictory health information found on the internet. I want to distill all this information down to a form that you can use every day to optimize your health as you move forward through life. So if you are looking to get to life's finish line with the ability to do the things you love intact, then this podcast is for you. If this is your first time here, please don't forget to smash the subscribe button and throw us a like as well. It really helps us get this information out to more people. With all that said, let's move on with today's episode. Hello and welcome to this long overdue episode of the Human Momentum Podcast. We're going to be trying to tackle a particularly complex subject today that has recently popped up in the news. And I wanted to review as much of the available research as I could to make sure that I am getting this right and getting you information that you can reasonably use to make good medical decisions in your life so as to minimize the potential problems associated with autism. For those of you that were somehow hiding under a rock and missed it, a couple of weeks ago, the White House and the Department of Health and Human Services held a large press conference where they discussed a number of potential causes for the rather massive increase in autism incidence we've seen over the past 4 to 5 decades. And they had recommendations on how they were going to fix it. So to kind of tip my hand a little bit and tell you what I'm thinking about the entire thing, I think that they missed the boat a little bit. So to give you a little history on this, our Secretary for the Department of Health and Human Services, Robert F. Kennedy Jr., came out and made a statement this past spring that he and his team were going to get to the bottom, quote unquote, of what's going on with autism in the United States, and they were going to have answers for us within 6 months, and that they were going to fix this problem. And I think this press conference was really motivated by a desire to follow through on that promise. And unfortunately, I think it missed the mark. And I think they gave us a lot of information that is not going to be helpful in the long term for greatly reducing autism risk. So let's talk about where we are and how we got here with regards to autism in the United States. If we go back to the year 2000, which is not far back enough to capture all of the increase, but does capture enough of it that we get a picture of what's going on, we had an incidence of 6.7 cases of autism spectrum disorder diagnosed for every 1,000 live births in the United States. By 2022, that number had ballooned to 32.2 cases of autism spectrum disorder per 1,000 live births. Now, that 5-fold or so increase looks alarming, but we do have to take some additional things into account when we look at this, because comparing how often autism was diagnosed in the 1970s, the 1980s, the 1990s, or the 2000s to how often it's diagnosed today is not an apples to apples comparison, because the diagnostic criteria for autism spectrum disorder, how it was described and what it actually is, has been changed significantly over intervening years, beginning in 1987 and repeatedly through the 90s, 2000s, all the way up through 2013. We revised our definition of what constitutes autism spectrum disorder and how we diagnose it. As a result, we are catching a great many children that we are now diagnosing correctly as being on the autism spectrum that were just being missed in prior decades. And we think, depending on who you talk to, anywhere between 40 to 60% of the increase in diagnoses that we've seen are just due to the change in criteria, with another 20 to 30% being accounted for by the increased awareness in both the medical community and in parents that we've seen over the past several decades. So depending on, where you're sliding on that scale, somewhere between 60 and 90% of the increase in cases we've seen are due to just the changes in diagnostic criteria and our expanded awareness of the problem. Now, that does leave a significant number of autism cases every year that are occurring now that were not occurring decades ago, that are not attributable to these changes in diagnostic techniques. So there is a role potentially for Tylenol in pregnancy to be accounting for at least a portion of these autism cases, if not all of them. So why don't we dive into the data that the administration brought up and evaluate it a little bit, as well as I want to go into everything out there that's been linked to the diagnosis of autism spectrum disorder, ADHD, and neurodevelopmental disorders in general, and talk to you a little bit about the other potential causes we have for these cases and what we know about them. So, with regards to this idea that Tylenol use in pregnancy is generating this big increase in autism incidence in the United States, they were largely citing a August 2025 study published by the chair of the Harvard Department of Public Health at Harvard Medical School. So a very prestigious institution, an individual by the name of Andrea Baccarelli, an MD, who has long suspected that Tylenol usage in pregnancy is one of the causes of autism spectrum disorder that we've seen. And he may potentially be at least partially correct. I do not believe the data supports the idea that this is the primary cause of autism spectrum disorder that we're seeing in the United States. So the study he produced looked at 46 previously published papers and applied a rather fancy statistical analysis to the outcomes from each of those papers to try and determine a correlational link between Tylenol usage in pregnancy and autism spectrum disorder. One of the problems with this study is that it was not a meta-analysis. It did not pool the data from all of these studies, but just looked at each of them individually and tried to get a gestalt or sort of an overall sense of what the data was suggesting. And because of it, I think it underweights the results of a couple of the studies they did include that were much larger than some of the studies that were suggestive that Tylenol usage in pregnancy may cause autism, because these larger studies that had better controls, in many cases, they were using sibling controls where you had a sibling who received Tylenol during pregnancy and a sibling who did not. So they have very similar genetics, because we know one of the major risk factors for developing autism is genetic, and that heritability is one of the major factors in autism spectrum disorder. So the studies that really took great pains to eliminate genetics as a confounding factor did not find a significant link between Tylenol usage in pregnancy and autism. It was only studies that did not take or implement methods to try and eliminate genetics as a potential confounding factor that did find a link. And because of it, we have to wonder if the link that is seen between Tylenol and pregnancy is purely coincidental. Even with the study results from Dr. Baccarelli, I don't think we can definitively say there's even a correlational link. He did conclude there was, but I do call those results into question somewhat based on this. If you want to see a better, more detailed analysis of the outcomes of that study, Dr. Peter Attia on his YouTube channel linked to his Drive podcast does a much more in-depth, detailed analysis of the study, breaking down not only the study itself, but all of the included studies to try and get to a more complete result. But even if you buy that this correlational link is real, the outcomes of those studies showed that the increase in risk was very modest, maybe 1.05 times. Certainly not enough of an increase to account for all of the cases of autism that are occurring now that were not occurring years ago that aren't accounted for by the differences in diagnostic criteria and awareness. So if Tylenol use in pregnancy isn't the major driver of the increased incidence of autism in the developed world, then what is? Well, we do have a couple of potential explanations for this. And one of the things that we should keep in mind is that recent studies using functional MRI to image the brain of newborns and then children as they age has indicated that most likely the changes that occur in the developing brain that lead to autism are present at birth in almost all, if not all, cases of autism. So if we keep that in mind, we are not looking for exposures that occur after birth. We are looking at exposures that occur in utero as our primary causes for this increased incidence of autism. And when I say in utero, I mean that occur inside the uterus to the developing baby. And also then, we're also looking for potential causes that link to the actual genetics of the child, things that can influence that. So as it turns out, one of the strongest correlational relationships we have between some kind of causative factor, potentially causative factor, and autism is advanced paternal age. So one of the things we have seen over the past 50 years is that increasingly more and more often men are fathering children when they're older. And what we found is a paternal age over 40 at time of conception significantly increases the risk of having an autistic child, more so than, as it turns out, any other factor we've identified. There is a very strong correlation between those two ideas, with an even stronger effect if the paternal age is over age 60 at time of conception. Additionally, a maternal age over 35 is a much less potent potential risk for having an autistic child or a child with neurodevelopmental disorders. And there is risk for a numerous number of problems with a child as maternal age advances. We are now occasionally seeing women approaching the age of 50 or even past it having children. And of course, this means an increased risk of any kind of developmental disorder, including neurodevelopmental disorders like autism spectrum disorder and ADHD. So we have even more factors that have strong links to the development of autism spectrum disorder. One of them is maternal obesity. And we strongly suspect that this links to metabolic health, because that risk goes up even further in women who have known type 2 diabetes or develop gestational diabetes. The obesity risk is definitely there. And if, in addition, they have known insulin resistance based disorders, then that risk elevates even further. Another factor that there has been a strong link between exposure and the development of autism spectrum disorder is air pollution. There is a specific type of air pollution. It's particulate pollution of a type called PM 2.5. These are very small particles that are associated with the burning of any sort of fossil fuel or even wood. So we've seen certainly an elevation in this type of air pollution with wildfires that have occurred both in Canada and in our western states. We see an elevation of this with the burning of coal and the burning of fossil fuels like gasoline. So exposure to this type of air pollution is usually far higher in developed countries than it is in the developing world, and that may account for some of the differences we see in autism rates between the developing world and developed countries. These types of particulate are so small that when you breathe them in, they go into the bloodstream, they readily cross the placenta, and they have been shown to adversely affect neural development, particularly in the third trimester. Okay, and that brings us to the final factor I wanted to discuss, which was a surprising one that I had not been aware of before I did the research for this video. It is a risk of developing autism spectrum disorder and all neurodevelopmental disorders that is associated with sunlight exposure. although in this case, it's lack of sunlight. One of the things that we have seen is that, particularly in folks under the age of 40, the rate of going outside and getting regular sun exposure has plummeted since the beginning of the pandemic. And we have compelling research showing that vitamin D deficiency, which can occur when you don't get enough ultraviolet B radiation, is a significant factor in inhibiting normal neural development and may well contribute to the development of autism spectrum disorder. Additionally, we have found that long wave infrared light readily penetrates the human body. This is also a type of radiation that is produced by the sun. It does not readily penetrate the atmosphere when the sun is at a somewhat oblique angle to the earth, and thus the more northern and southern latitudes don't get this type of light penetrating very readily in large amounts to the surface of the earth during the winter months. But this light will penetrate clothing, it will penetrate the body and the maternal abdomen. And we now have animal studies that show that this kind of light stimulates the production of a specific type of melatonin inside the energy producing organelles in our human cells called mitochondria. And this type of melatonin is protective against oxidative stress. One of the predominant theories we have right now on what causes autism spectrum disorder and ADHD to develop in children is oxidative stress in the developing central nervous system. So if these theories are correct, and we need a lot more research to confirm these ideas, then it is possible that more sunlight exposure and gestating during the summer months as opposed to the winter months may be very protective against autism spectrum disorder. Again, these are very interesting ideas, but ones that need confirmation. We've also seen a very strong correlation with young children who have lower vitamin D levels and the development of autism spectrum disorder. Kids with autism generally have been found to have low vitamin D levels much more frequently than healthy children. And so there are some things we can take away from all of this with regards to autism. And I'm going to discuss those in just a little bit because I do want to jump ahead to one other topic, and that is vaccines. For a long time, we've had a lot of controversy that vaccines, particularly the MMR vaccine, is causative of autism. And this idea was really pushed to the forefront in the late 90s when a researcher by the name of Andrew Wakefield in England published a study in The Lancet, a very prestigious medical journal, that claimed to show that the MMR vaccine had caused autism in 12 children that he studied. Well, first off, even if he were able to conclusively link the MMR vaccine in just 12 children, it would hardly establish a full-on causative mechanism. And as it turns out, when researchers in the 2000s tried to reproduce the results that Mr. Wakefield had gotten in his research, they couldn't do it. And it made them suspicious. And eventually, a research assistant became a whistleblower and produced evidence that conclusively showed that Mr. Wakefield had fabricated some of his results and had cherry-picked data and discarded data that pointed away from his hypothesis and pulled in only data that supported it, excluding cases, and in some cases, flat out fabricating numbers in order to support what he was pushing forward. He was disgraced. He was stripped of his medical credentials in the United Kingdom. And in fairness to him, he claims to this day that this was all a witch hunt, that his research was sound, and that it was just the pharmaceutical industry that pushed forward this idea that he had fabricated his data and has sought to discredit him ever since. There is really strong evidence that he's incorrect in saying that, and that the administrative authorities in the United Kingdom acted appropriately. So he continues to be involved with the anti-vaccine movement in the United States, and push forward this idea that the MMR vaccine is causing autism, in part in response to some ideas that he was starting to put out there and just an overwhelming burden of concern in the early 90s. In 1993, Japan separated the MMR vaccine and began giving its three components at separate times. And they did this for more than a decade. Despite that, Japan saw the same ballooning in autism rates that we saw in the rest of the world. So I think we can pretty much conclusively put to bed the idea that the MMR vaccine has anything to do with autism. So it was very disturbing to me to see as part of this press conference that without any real data to support the idea, the Department of Health and Human Services was recommending not to give the MMRV vaccine that rolls in vaccination for varicella, that is chickenpox, along with the MMR. Their argument basically is that chickenpox is a relatively harmless childhood illness, that serious complications of it are rare, and that delaying varicella vaccination is relatively low harm. I just disagree with this because we know that delaying vaccination results in a lower rate of vaccination. And while varicella vaccination does indeed provide a very small decrease in serious illness in childhood, it is very protective later in life. Individuals who do not catch chickenpox as a child do not get shingles as adults. And I saw so much disability and just general misery with shingles during my time in practice. And we are very frequently seeing incidents of shingles occurring prior to the age where insurance will cover vaccination against shingles. And the shingles vaccine only cuts down the incidence of shingles by about 90%, whereas childhood vaccination with the varicella vaccine cuts that incidence by close to 100%. And it's just such a miserable thing, with 1 in 5 individuals who contract shingles developing post-herpetic neuralgia, which means the pain from shingles never goes away and they just suffer with horrible neurologic pain the rest of their lives, which is very difficult to treat. I just don't want to see this for folks. So I would prefer to see the MMRV still used with regularity in kids, because I think that any potential harm from it is far outweighed by the benefit of not getting shingles later on. And with all of these interventions, that's what we're trying to do. When it comes to a vaccine, we're not saying whether it's COVID or influenza or any childhood vaccine, we're not saying that there isn't a potential for bad outcomes with that vaccine. We are acknowledging that there are. But what we're saying is that the benefits that these vaccines confer, with how effectively they cut the incidence of measles and mumps, rubella, polio, varicella, influenza, and COVID, at least serious infections in the case of influenza and COVID, that the benefits that those vaccines convey far outweigh the problems associated with adverse events from those vaccines. That's what we're saying. All right. So the final thing they discuss that I would like to talk about is the hepatitis B vaccine. And the recommendation was made, particularly by our current sitting president, that we wait to vaccinate kids for hepatitis B until they're 12 years of age. Never mind the effect that this would have on reducing the total number of people that receive the hepatitis B vaccine, because adolescent vaccine schedules are just not as closely followed by parents as the childhood vaccine schedules are. And we're also just frankly losing vaccine mandates in a lot of states. And because of that, there's going to be a large portion of adolescent kids who never get vaccinated for pneumococcal vaccine or anything else that's prescribed, much less hepatitis B. And let's be absolutely accurate here. The policy of vaccinating all kids at birth with hepatitis B vaccine eliminated 18,000 neonatal hepatitis B cases annually. And this is a big deal because if a child contracts hepatitis B as they're born or becomes infected very early in life, they are far more likely, 90% likely, to develop chronic hepatitis B. And that means their risk of getting liver cancer, the risk of needing a liver transplant, getting cirrhosis, going into liver failure is just far, far greater than even an individual who gets infected with hepatitis B as an adult, much less the general population. And that, again, is a lot of misery for a child that just doesn't have to be. And one of the things that's noted in that data was that only 9,000 of the infections were occurring during delivery or just prior to delivery and were coming from an infected mother as they're giving birth. And one of the other things we need to acknowledge is that a lot of hepatitis B testing occurs early enough in pregnancy that there is time prior to delivery for a mother to become infected and us to miss an infected mother giving birth, even with the testing regimens we have in place. And beyond that, 9,000 of those 18,000 infections were occurring before the age of 18 months due to a household contact generating an exposure with the child. And it can happen a lot of ways. If an infected adult in the household bleeds onto a child's toy, the child puts that toy in their mouth, they can become infected. If they share a toothbrush, if in some cases, if there is any sort of open wound in the mouth in the infected individual, if they share utensils, it becomes easy to infect that kid if there's somebody else in the house who has hepatitis B and doesn't know it. Because of that, I think we need to stick to vaccinating kids as they're born, especially because there is no evidence of any kind that shows vaccines are connected to autism, and certainly not the hepatitis B vaccine. So, again, I fully support continuing with our prior practice of vaccinating every child who's born for hepatitis B, just to be safe. All right, something else interesting to note is there was a group of refugees from Somalia who were evacuated during the 90s, during the chaos that happened in the mid 90s in Somalia. And the US, remember, we had troops there, Black Hawk Down, that whole thing happened there. We had troops present in that area. And because of it, locals who supported the US forces when they were there and helped us out were evacuated and given asylum after we withdrew from the area and the UN withdrawal was complete. And the majority of these Somali refugees were relocated to Minneapolis, Minnesota. And an interesting thing that happened is in the decade or so after the relocation, they saw a 16-fold increase in the incidence of autism within that particular Somali immigrant population. And what in part makes that interesting is that these particular refugees came from an area of Mogadishu where they had access to a World Health Organization vaccination program for more than a decade prior to their relocation. And so vaccination rates amongst children and adults did not change when they relocated to the US, and yet we saw this big bump in autism. So obviously that points to other factors, whether we're talking about air pollution, which something very real to consider is during that time just prior to their evacuation, there was a lot of burning of tires and cars and residences that occurred in Mogadishu. So it's possible that those mothers took in a lot of those 2.5 PM particles during the time they were pregnant. So maybe that's why the autism rates jumped so quickly after the relocation in the United States. Also, rates of obesity in that population predictably exploded after the relocation. And you also saw relatively soon after the relocation that the ages at which parents began having children did advance. So probably a bunch of factors there. And that really helps kind of tie up the overall idea I wanted to convey with this video, which is this topic is not a simple topic. The causes for the increase in rates of autism throughout the world, because it's not just the US, China, Japan, Indonesia, the Philippines, Europe, certainly, and even some regions in Africa and Brazil have all seen an explosion in autism rates over the past several decades. And I think when we start to evaluate all these potential causes, we can start to point our fingers at multiple things. So if you are someone who is looking to have children, what do you do? Well, number one, with regards to Tylenol, I do think it's prudent to use as little as is absolutely necessary. Controlling fevers during pregnancy is still vitally important. Fevers during several points in pregnancy can lead to neural tube defects if they're allowed to go to 101 or higher. So absolutely taking Tylenol in that case is the safest way to control the fever. Also, if you're having intractable pain that is causing distress and interfering with sleep as a expectant mother, then definitely if Tylenol helps with that, take it. Don't take any more of it than you need. Take the lowest effective dose and take it as infrequently as you can manage, but take it, because interference with sleep has been shown to be detrimental to the developing fetus. Also, something to know, naproxen, ibuprofen, aspirin are not safe to use in pregnancy, particularly not in the third trimester when they can induce premature labor and miscarriage. And remember, another risk factor I did not discuss and really should mention now is premature delivery. A child being born prior to 36 weeks is a major risk factor for development of autism spectrum disorder and ADHD, and might even be a risk prior to 38 weeks, but definitely before 36, we see a rapid increase. And that's another thing that has become more common in recent years. And certainly with regards to those Somali refugees, kids born prior to 36 weeks pretty much didn't survive in Somalia. When they relocate to the US, suddenly they do. So that's another factor. Complex issue, certainly checking your vitamin D levels as an expectant mother, also very helpful. Supplement to between 40 and 80 nanograms per deciliter. If you are below that 40 threshold, that may help prevent autism. Trying to get as fit as possible. And if you do have diabetes, prior to getting pregnant, if you can try and get as fit as you can and maintain lifestyle control of your blood sugars, that would be very helpful. And certainly if you're an older parent, just be aware that the risk goes up. I'm going to put links to all of the research that I reviewed for this podcast presentation in the description of this video. And I'm also going to put links to Dr. Peter Attia's episode on autism and Tylenol. It was excellent. And if you want a much more in-depth explanation of all of the science associated with my analysis of just how causative Tylenol might be, he does a much better job of explaining it than I could. Additionally, I'm also going to put a link to a couple of videos from Dr. Mike Vashovsky, a primary care physician who has a huge internet footprint, as he also covered this topic as well as the hepatitis B vaccine topic very well. So do check out those videos, and I would suggest subscribing to those channels and checking them out because the information on them is top-notch. Thank you so much for joining me as we walk through this complex topic today. I will have additional information for you in the coming weeks on numerous other topics. So if you found this helpful, please don't forget to give us a like, subscribe to the channel, and go ahead and comment if you have questions. All of that really helps me get information out to others. And I really love to get questions from those who see these videos and see if I can help answer them for you. Thank you so much for tuning in, and I will see you next time.